Assalamu alaikum warahmatullahi wabarakatuh. Good evening, everyone. My name is Hatam Mutara. I'm a plastic surgery resident from King Saud University Medical City, Riyadh, Saudi Arabia. I'm the president of the Plastic Surgery Interest Club. I welcome you all today in our webinar. اليوم إن شاء الله I will have an important webinar for all the medical students and interns who are interested in plastic surgery as a career. They will definitely find this webinar very informative and useful for them. Without further ado, I would like to introduce Dr. Salman Qasim. He's a plastic surgery consultant BGY1 at National Guard Hospital in Riyadh, and as well as the leader of the social media committee in the Plastic Surgery Interest Club. MashaAllah, Dr. Salman has published more than 20 papers. He's very active in research, as well as in his giving to the Society of Plastic Surgery. سلمان تفضل the mic is yours.
Assalamu alaikum, مساء الخير جميعا. I'd like to thank you for inviting me today to give this brief introduction about the specialty. As Dr. Hatan said, I'm a plastic surgery resident in R1 and NGHA in Riyadh. Today, inshallah, I will talk about plastic surgery as a specialty in general, tips and tricks into how to get accepted in the Saudi local program, as well as the subspecialties that plastic surgery provides. And then we'll have some time at the end for questions and answers, inshallah. To begin with, plastic surgery is one of the broad specialties in surgery per se. It is very diverse, and this is what makes plastic surgery, I think, a very special and unique specialty, is that it's very diverse. You can operate almost anywhere in the body from head to toe. You can operate on bony structures, you can operate on soft tissue structures, you can operate in the adult population, you can also operate in the pediatric population. So it's a very diverse specialty, which makes it extremely unique. Plastic surgery, there is a huge misconception in the society that plastic surgery only includes aesthetic surgery or cosmetic surgery, which is not entirely true. Aesthetic or cosmetic surgery constitutes about 10 to 20% of the whole specialty. So we have plenty of other things and plenty of other surgical and medical entities that we are concerned with. For example, a plastic surgeon operates in the hand. A plastic surgeon does reconstructive surgery. A plastic surgeon operates also in aesthetic aspects, which is depicted in rhinoplasty, blepharoplasty, abdominoplasty, mammoplasty, so on and so forth. And also small procedures like Botox injection, as well as fillers and so on. So it's not just about aesthetics, it's a lot of things. There are also, as I mentioned, multiple subspecialties in fact. Yes, sorry to interrupt. There are 6 major subspecialties within plastic surgery. The first is aesthetic surgery, which all of us know. جراحة التجميلية البحتة يعني. Then we have hand surgery, which is one of the major subspecialties in plastic surgery. Then we have microsurgery, which is concerned about flap reconstruction, where we have to perform small, tiny little anastomoses between the arteries and veins, and also to do nerve reconstruction, tendon repair, tendon or nerve transplant, so on and so forth. Then we have pediatric plastic surgery, which is affiliated with congenital anomalies of the children, from craniosynostosis to many other things, even brachial plexus injury. And also we have craniofacial surgery, which is related to craniosynostosis. So we have pediatric and craniofacial surgery, which are sometimes closely related, depending on the anomaly or the pathology that the plastic surgeon is treating. So this also enforces the fact that plastic surgery is a very diverse specialty. So this is just an introduction about plastic surgery. Would you have to add anything?
Yeah, I totally agree with you, Dr. Salman. بخصوص plastic surgery is a massive and widespread, has widespread specialty, as well as the fact that there is a big misconception about plastic surgery among medical students as well as interns. جميع بفكر plastic surgery is purely cosmetic or purely aesthetic. Plastic surgery only do rhinoplasties or abdominoplasty, etc. But this is not the true fact about plastic surgery. Plastic surgery actually have a lot of subspecialties in it, including, as Dr. Salman mentioned, from which we can operate from head to toe. So, what actually made you like select plastic surgery, Salman, and what actually made you interested in plastic surgery itself?
So to begin with, I was interested generally in surgery because we have two schools in medicine. We have the medical part and then we have the surgical part. If you, as a medical intern or a student, at least know which school you would like to be affiliated with, then this is, for me, a very good accomplishment. So from the very beginning, I was more into surgical specialties, which includes general surgery, neurosurgery, orthopedic surgery, plastic surgery, pediatric surgery, so on. So I executed all the medical specialties because I like to work in the OR. I like the lifestyle of a surgeon, more of the lifestyle of a medical specialist. So I decided that I wanted to be related to surgery. This was the very first step. Then I gave myself the chance to explore my options, especially during internship. I had a late interest in plastic surgery. I was not interested in plastic surgery in like fourth year medical student or fifth year medical student. So I was not quite sure which specialty I'm into, which surgical specialty I'm into. So during internship, I gave myself the chance to explore different specialties. I tried general surgery, I tried orthopedic surgery, and I tried also plastic surgery. And from those options, and also I tried ENT as well in تخصصي. So from those surgical specialties, I liked plastic surgery the most because of the aforementioned reasons, because it was a very broad specialty. It gave me the chance to work in bony structures, which I like in orthopedic, for example, as well as soft tissue. You could work in all age population patients, which is a huge advantage to the specialty. One day you can have a carpal tunnel surgery, the other day you can have a flap reconstruction, and other days you could have a breast reconstruction. Also, you can work with burn surgery, which is a very diverse specialty, and it's never routine. It's almost always not routine. You continue to work with a new challenge, a new maybe case, sometimes rare cases, also sometimes common cases. So you get to work in different and many aspects within your career. Of course, to add, with the addition to the fact that a surgeon is a respected physician in the society, not only a plastic surgeon, but any other physician and a surgeon. So this also adds to the value of the specialty, I would assume. So after I tried all those specialties, I think I chose plastic for those reasons. It is a competitive specialty indeed, but if you like the specialty, you can do whatever you want to do or whatever it requires for you to do to get accepted in this program, whether locally or even internationally. So moving to the tips, I think once you have a decision and a clear vision onto what specialty you'd like to join, now you start to prepare to your CV and your electives to increase your chances of getting accepted in the program. So I think a very good beginning in your internship career, for example, is to take electives within the specialties you are interested in. I was not quite sure, so I took an elective in orthopedics, I took an elective in ENT, and also I took an elective in plastic surgery. So I'm not saying that you should take all three electives in one specialty. No, it is logical and it is common sense that you take electives in different specialties to explore your options and to test whether you like or dislike a certain specialty. Because some individuals and some interns have an idea that in order for you to have a very strong interest, you have to take all your electives in one single specialty, which is not necessarily true. And I deeply believe that the interview committee and the physicians will understand that you having multiple specialties as an elective is a valid point. It's not that you are not interested or you're trying or you're considering other specialties, but that you are actually testing the water. So first step is to take electives, especially during internship. Second of all, that you show good commitment and good interest during the elective. This is manifested in that you attend early, you do your work appropriately. For example, you do not leave the hospital without permission from your senior, without confirming that everything has been done appropriately and on time. And obviously, at the end of the internship elective, that you take a reference letter or at least a recommendation letter from prominent physicians within the specialty. For example, the program director or the section head. Those are strong, good, prominent names that would definitely improve and increase your chances of getting accepted, not only in the center that you trained in, but also in other centers that you are applying in the future, because all of them know each other, and sometimes they communicate with each other and share experiences onto whether you're a good person, you're a committed person, or otherwise not. So these are the major tips that I highly recommend for any intern who is interested in plastic surgery to do. Another very important aspect is research. Research is a very good point to show everyone, whether it was physicians who are going to interview you or future employers that you want to be affiliated with, or your colleagues that you are interested in a certain specialty. So starting a research in the field is an extremely important step to aid you to getting accepted in local programs and especially in international programs, whether it is in North America or in Europe, because research is an international standard value that is added to you as a physician, and that proves that you are an interested person in that certain specialty. So three major things: electives, recommendation and reference letters, and research. These are three important aspects that nourishes your CV and hopefully increases your chances of getting accepted in the specialty.
Perfect. That's super well covered, Dr. Salman. يعطيك ألف عافية. Regarding interns, I think some interns can find it very difficult to have to contribute to the team itself during the rotation or the elective. Do you have any tips for how the interns can actually contribute to the team by being helpful and leaving good or a very good background or positive attitude in the rotation itself?
Yeah, sure. That's a very good question. Actually, some interns think that they are expected to be super knowledgeable within the field. They are expected to know details about the anatomy, details about the cases, details about everything in plastic surgery, which is somehow psychologically overwhelming. So the thing is, from my own experience, I believe that what others are expecting from you is that you be on time. This is one major aspect. You have to be on time. If you are doing the round on 6:30, you have to be there before 6:30. You have to see the patients on the system. You have to understand what medications they are on. You have to understand what their active issues are. You have to understand the reason of admission, the new labs, whether there are abnormal labs, so that when the team comes and the senior comes and even the consultant comes, they know that you are fully aware about the patient. You have read the patient's file and you have known exactly what active issues are there in the patient. So not necessarily, for example, if you have a carpal tunnel case, it's good to read briefly about the anatomy, what is the procedure to be done, what are the risk factors of carpal tunnel syndrome, what are the medical and surgical options, for example, for carpal tunnel syndrome, whether it affects males or females more, so the epidemiology, briefly, not to understand for example, surgical techniques, what are the approaches in surgery. So those are maybe in other levels of knowledge. So just to assure you guys that you are not required to know everything about the specialty, at least you have to show good commitment. Another thing that I would recommend is that the OR list. For example, if you have an OR list tomorrow, at least go over the cases. Know what cases you are expected to have, because you might get asked during the OR. For example, if the case was about trigger finger or ganglionic cyst excision, for example, at least be aware of the case, what is causes, as I said before, because you might get asked. And if you get asked and you answer appropriately, this is a good reflection on you for the team and maybe for the consultant who is going to interview you in the future. And also, what I did honestly during my elective during internship is that I requested to present during the teaching session. So luckily, we had a very interesting case. I went into an OR. It was a flexor tendon reconstruction surgery in the forearm. And when the surgeon did the dissection and opened the forearm anteriorly or vorally, they found an anomalous muscle. It was a palmaris longus muscle that was abnormally formed. It was a variation, anatomical variation that is constituting an anomalous palmaris longus. So it was an interesting case. I took pictures of it. Then I excused the senior to obviously present the case in the teaching session. So it was a very good chance for me to prove myself and to present the case in front of all the residents, from the juniors all the way up to the seniors, as well as in front of the program director, as well as the section head. Luckily, all of them were there attending that at that time. So this is another thing that you can do. You can present cases. You can ask that you want to talk about something, a topic, for example, not necessarily a case, but a topic in plastic surgery, just to show that you're interested and to introduce yourself. Well, you say, my name is Fulani Fulani. This name will because you are presenting something that not everyone does all the time. So this is another way of increasing your chances. Another thing is to diversify your electives. Do not take all your electives in the same place. You have to take, for example, an elective in your primary center. If you are from King Saud University, at King Khalid University Hospital, this is one good option, because theoretically your chances of getting accepted there are higher. Then you have to take an elective somewhere else, maybe at NGHA or at King or مدينة الملك فهد الطبية مثلا KFMC or so on, different centers. Also التخصصي King Faisal Specialist Hospital. So try to diversify your options so that during interviews you have a higher chance of getting accepted, not only in your primary center but also in other places. So these are fundamental tips that I greatly encourage you and advise you to follow in order to, inshallah, increase your chances of getting accepted.
يعطيك العافية سنة. بخصوص centers, if you had the opportunity to categorize it or like just put it in arrange the centers based on your experience, how would you arrange it مثلا من ناحية يعني أكثر أماكن تنصح فيها وأقل أماكن مثلا تنصح فيها for elective?
Okay, so thank you for this question. Honestly, all centers are good because, come on, we're talking about four or five seats in Riyadh. So, for example, if you got accepted in any center, it would be excellent because the competition. All centers are good in terms of plastic surgery, but there are differences. For example, King Faisal Specialist Hospital is not a trauma center. It's quite an advanced center where you can see many recon cases, many flap cases that take long hours in the OR. So these are more of an advanced setting for a junior resident, for an R1 or an R2 or even an R3. So this is one major difference between other centers and King Faisal Specialist Hospital, for example. NGHA, which is the center I'm affiliated with, is a trauma center. It has its own burn unit. It's a major referral tertiary level 2 trauma center in the kingdom. So you get to see trauma cases, you get to see common cases like hand cases, and you also get to see burn cases because it has its own burn unit. For example, King Saud Medical City does not have, it is a trauma center, but it does not have a burn unit. But at the same time, it's part of the joint program where you can rotate in security forces where there is a burn unit. You can rotate in Prince Sultan Medical Military City where there is a burn unit. So each center has an advantage and a disadvantage. For example, I like security forces. I trained there as an elective in the internship year. It's an excellent center. It has moderate load. It has a burn unit, but it's not a referral center. So you get to see certain cases, but not, for example, trauma cases, major trauma cases. So each and every center has its own benefits and advantages and disadvantages. But for me, I think one of the top centers, honestly, and I'm not being biased, but one of the top centers is NGHA and Prince Sultan Medical Military City, because they're big centers, they're trauma centers, they have their own burn unit. You have a variety of cases, you have aesthetic cases, you have hand cases, you have recon cases, you have burn cases, surgeries. So you get to see quite everything in those centers. And for what I like about NGHA is it's an independent program. Sometimes this is an advantage. To me, it is an advantage. Maybe to others, it's a disadvantage, because in the joint program, you get to rotate in different centers. You get to see different consultants. You get to expand your connection. You get to expand your opportunities in research. You get to expand your knowledge and surgical techniques, because each consultant has his own or her own way of doing things. But you have to rotate 6 months مثلا في العسكري, 6 months في الجامعي وهكذا. So you have to learn a new system, new places, new people, a new environment. For me, this is overwhelming. I'd rather stay in the same place than to have rotations every 6 months. This is my own preference, طبعا. This is why I was going to go to NGHA or King Faisal Specialist Hospital, which is an independent program as well. So yeah, as I said, on top of the list, you have NGHA and Prince Sultan Medical Military City, and also King Saud Medical City, because of the prominent consultants and senior consultants there in that center.
Yeah, I totally agree with you, Salman. Regarding, speaking of the independence of a couple of programs, how many programs are there in Saudi for the Saudi board? And how many applicants they usually accept?
For the Saudi board, there is the joint program, there is NGHA program, and there is King Faisal Specialist Hospital program. So there are 3 different programs within the kingdom.
This Riyadh.
Yes, in Riyadh there is so yes, these there are 3 there are those 3 options, as I said. Al joint, which has King Saud Medical City, Prince Sultan Medical Military City, التجمع الصحي الثاني اللي هو King Fahd Medical City, and Prince Mohammed bin Salman Hospital. And there is NGHA, which is an independent program, which is King Fahd Hospital. And also there is the third option, there is King Faisal Specialist Hospital. So each year, the accepted number of accepted residents ranges from 4 residents up to 7 residents. This year, on my matching cycle, they accepted 4 residents, 2 in NGHA, 1 in Prince Sultan Medical Military City, and 1 in King Faisal Specialist Hospital. This was an unusual number صراحة, because usually it's higher, usually it's 7 or 6. But there was an issue in the joint program. I'm not quite sure about it, or I'm not sure why they reduced the number of residents in the joint program per se. Because usually in the normal situation, they accept 1 in security forces, 1 in Prince Sultan, and 1 in King Saud Medical City, and also 2 in NGHA, and 1 in King Faisal. And sometimes مدينة الملك فهد الطبية, sometimes they accept a resident every other year. And this year, yes, the next year, no, and so on. But this year was an exception. They accepted only 4 residents. So these are the options for you to have. One thing to add is that if you take an elective in one of the centers affiliated in the joint program, this increases your chances of getting accepted in one of the hospitals affiliated in the joint program. يعني مثلا إذا أنا تدربت في العسكري ولا في قوى الأمن ولا في الجامعي, كأني غطيت الجوينت program وغطيت ال other centers, because they are all the same entity, they have the same program director, they have the same connection, they gather together, they discuss their options, and then they choose the residents that are going to be distributed on the joint program. So if you have 3 electives, for example, 1 should be in NGHA, the other in one of the joint program hospitals, and the third maybe in King Faisal Specialist Hospital, so that you cover all your options. فأنا أخذت 1 in NGHA, The other was in Security Forces Hospital to cover both NGHA and the joint program. And the third elective, I took it ENT in King Faisal Specialist Hospital.
Do you have any idea about the number of applicants or who got accepted for Eastern or the Western region?
Nominees this year were 7 residents, and the accepted number of residents
in the Western, right? غربية.
في الغربية, no. في الغربية, I'm not quite sure, but في الغربية 2 residents got accepted, from what I know. But the nominees, I think, were 5. I'm not quite sure, actually, but less than the numbers in Riyadh. And in Al-Ahsa, 1 of the residents got accepted. Nominees, I think, were 3. 3, I think, nominees 3, and they accepted only 1 in Al-Ahsa. So as we can see, the numbers are very minimal. That's why the competition is very high in plastic surgery. But inshallah, we are optimistic that the numbers are going to increase in the upcoming years.
Regarding one of the most important factors for getting accepted in the Saudi board is the SMLE score. Do you think there is a specific quote-unquote safe SMLE score for getting nominated into plastic surgery?
Honestly, there's no safe score, because it is a combination of your GPA, your SMLE score, and also your CV points. Let's say that all of the applicants took 14 out of 20, which is the maximum CV score in the matching cycle or in the تخصصات for fresh grads. So let's say all of them took 14 points. Now the narrows to your GPA and SMLE score. For example, if someone scores very high in SMLE, but their GPA is not that high, this would balance their application and makes it more average-like compared to someone who has both high SMLE and high GPA. And then this is also vice versa. If someone has a very high GPA but an average SMLE, then this would make their application average or less likely to be competitive. So, but generally speaking, I think nowadays we are honestly, we saw SME scores becoming very high. So each year SME scores are becoming very high. I remember 2 years ago, if someone got 90 plus in SME, then this person would be a genius, honestly. 2 years back. 1 year ago, in my batch and the batch before, someone who gets a 91 or a 92, this would be a very high score. But now in this year, we saw, mashallah, people getting 95 out of 100, which is an exceptional and exceptionally high score that we did not see in the past 12 years, as per the Saudi board numbers and distributions and classifications, because they publish the scores every year. This was the very first year that someone gets 93 and above, even 95. So each year the competition is becoming more difficult and more difficult. And presumably having higher scores is becoming maybe a bit easier than before, maybe because studying became more different, available, more questions were correctly distributed and correctly marked. So these are any factors that make people get higher scores every year. So there is no actually safe score, but I would assume that 90 and above would be a reassuring score, along with a high GPA,
inshallah. Regarding if someone who's actually not sure whether to pursue his residency locally or abroad for plastic surgery, do you have any tips, like whether if they can, how they actually can choose whether they want to pursue outside or locally? يعني ما هم عارفين مثلا يعني كم من السعودية يطلع برا for plastics.
حلو. صراحة شوف، اللي أنا بالنسبة لي لو أنا جاني قبول هنا، ولا أنا كواحد مهتم بالتخصص، لو جاني قبول بالlocal program or in the international program, I will go. Why? Because the competition, as I said, is very high. The seats are very minimal. So any chance in this specialty, حتى لو one of the consultants said لو جاك قبول في إسرائيل روح. The chances are very low to get accepted, سواء هنا في local program ولا في international program. So if you had a chance to have a residency training in Canada or in the US or in Germany or in France or in Saudi Arabia, go for it. It's a good chance. Few differences. بالنسبة لي 6 years is a lot of time. فأنا أفضل إني أنا to spend it locally with my family, with my friends' support, with my family support, rather than having it outside. This is my own opinion. بس having مثلا a North American board is a good يعني thing to have, an advantage أعتقد للphysician, because abroad, theoretically speaking, training is better. You have maybe good exposure, sometimes better than the local program, depending on your city and your center. And also in Canada, for example, the training is 5 years instead of 6 years. الإشكالية في الأبرود training إنه for me is when you finish the residency, you'll also complete the fellowship. So it's going to be from 5 to 8 years abroad, maybe alone.
That's true.
فشوية هذه
It's very difficult, صح.
Unless you're married or kids كده, you'll be mentally occupied. But if you're going alone, maybe you should. أنا يعني فيوزي بيفصل لو بروح لحالي كذا 7 سنوات 8 سنوات, I will go nuts alone هناك. I would prefer to stay locally to finish the program and to take the fellowship abroad. This is my personal preference صراحة. بس لو جاك acceptance elsewhere في North America ولا Europe, بالعكس very good opportunity ولا تضيعها, because if you turn it over, leave it, abandon this opportunity and apply the local program next year, you might not get accepted by local program. Then you would lose the local program and the international program. فهذه بس أعتقد التip very important. وكله كويس بالعكس, you will be a plastic surgeon سواء هنا ولا من برا. all options are valid and good when it comes to plastic surgery.
Honestly, I think it all depends on you. You know how much you're willing to learn, how much you're willing to contribute. وهذا الطبيب فكله يلعب دور عليك أنت, قديش تبي تتعلم وقديش تبي تشوف حالات وقديش تبي تشتغل.
Absolutely.
يعطيك العافية. So moving on, we'll go for the audience questions. For the first question from Dr. Hassan Zubaydi. He's asking, right now I'm a 6th-year medical student. I couldn't take a summer training in plastic surgery. Is it going to affect my chance to get accepted?
No, it will not. Sure, if you have a summer training in plastic surgery, that's good. If you don't, that's fine. أعتقد the most important time to do elective training is during internship. During internship, because you have officially من السيستم من الinternship system 2 to 3 months of elective in which you can take plastic surgery. خصوصا لو كانت مثلا in November, December, January, February, where the elective is close to the interviews, whereas theoretically the committee will more likely to remember you as if you took an elective early in internship in June or July. طبعا هذا all of this is theoretical, nothing يعني solid about that, so it will not affect your chances.
طيب, Amara Saif is asking, can a student from Jeddah or Dammam take an internship petitions in Riyadh?
Yes,
yes,
absolutely. Yes, many people do that. وبالعكس شيء كويس يعني to diversify your options and your cities.
And I think they just have to contact the postgraduate who they can fix it for them. So.
Yeah.
Okay. Rosanna Al-Bougami, she's asking, an elective, who's responsible to give you tasks to do?
The team. So you are distributed usually in 2 teams, team A, team B. This is, for example, in my experience in NJHA, there are 2 teams. Security forces, there are 2 teams. So once you start your elective training in plastic surgery, you will be assigned in one of those teams. And in the team, you will have a senior who is an R5 or an R6. Then also you will have juniors. Some juniors will be rotating in different specialties, and some juniors, the R3s and R4s, will be in plastic. So you will be distributed with teams, and then the junior will assign, the junior plastic surgery resident will assign you the tasks, will ask you to come, for example, at certain times, to see patients, to do consultations, to arrange imaging, so on and so forth. So it is from the junior, and the junior also takes other tasks and instructions and guidance from the senior. So you don't jump directly from your level to the senior. You go through the junior first, then into the senior. So chain of.
Another question is, which hospital has the highest cases load, especially in craniofacial cases?
That's a good question. In terms of load in general, العسكري والحرس والجامعي, they have very high load in multiple cases. بس بالكرينيوفيشل I'm not sure. وبالحرس عندنا البروجرام دايركتور دكتورة حنان is sub specialized بالكرينيوفيشل سيرجري، وعندنا affiliated بكينج عبد الله سبيشالست هوسبيتال فور تشيلدرن، فهناك في كثير كرينيوفيشل كيسز بالحرس، وكذلك بالتخصصي إن ما خاب ظني، يمكن تصحح لي دكتور هتان، بالتخصص craniofacial cases from what I know.
And actually also most of the craniofacial cases مثلا other than craniocytosis etc. usually it's covered by oromaxillofacial surgery which are the dentistry. ففي السعودية بشكل عام ال craniofacial شوية it's more of oromaxillofacial than plastic surgery. There is no much يعني exposure to craniofacial compared to مثلا other parts of the world. In case in plastic surgery, you know, it's being covered by oromaxillofacial surgery, especially مثلا trauma cases وهذا القبيل.
That's true.
Another question: how to prepare or what I have to do before the first plastic surgery rotation? What should I have to read?
حلو، في كتاب just give me 1 second. في كتاب اسمه Essentials for Students. طبعا أنا كنت intern، هذه يعني فيكس. يوم كنت انترن اعطوني هذا الكتاب، انا سالت نفس السؤال هذا بالضبط as an intern، والله يجزاه خير السينيور اعطاني هذا الكتاب PDF اسمه Essentials for Students Plastic Surgery. هو كان PDF فايل، وانا ما احب طبعا PDF كاني يعني من الجيل القديم، ما احب الPDF ولا احب الايباد ولا احب الاشياء زي، فطبعت الفايل او سويته ككتاب صغير بالطريقه هذه ووصلت تذاكر منه. فthis is a very good option. ممكن ارسله لكم واحطه مثلا في التغريده تحت او شيء. وفي الميج and basics about plastic surgery في الهاند وغير الهاند، فمره كويس. Again, do you have to memorize all this book? No. Just prepare cases قبل ال OR. Be aware of the indications of the surgery, the risk, the possible complications of the surgery, basics about the technique, والfollow up, post op مثلا follow up. هل يحتاج follow up؟ هل يحتاج شيء؟ بس هذه basic knowledge عن الكيسز. أهم شيء زي ما قلت الاتيتيود حقك تكون humble. طبعا البلاستيك سيرجري في الغالب كل اللي في الالكتيفز يعني دوافير صراحة. all of them have high scores, all of them have very good accomplishments, they have multiple publications، يعني هم نخبة الطلاب. you are one of them دامك وصلت للمكان هذا. try to be very humble, don't show that you are better than others. ما تسأل، يعني حتى لاحظت شيء صراحة، يعني ما لك علاقة في الأذر interns اللي معك في الروتيشن. يعني don't ask personal questions. What is your GPA? No need for this question. يعني what is your assembly score? كأنك قاعد تسأل امرأة كم عمرك ولا شخص كم راتبك. These are personal questions. Try to avoid. أنت هدفك مش to compare yourself with others. هدفك during elective to show that you are a competent person, you are committed, you are responsible, you are on time, you are punctual. صلى الله وبارك. والباقي توفيق من رب العالمين. You do يعني what you need to do، والباقي توفيق وتيسير من رب العالمين. just be on time, be committed, be responsible, and prepare the cases. And as I said, إذا حصلت لك الفرصة إنك أنت to present a case، ممتاز جدا. Yes.
يعطيك الف عافيه سلمان. الكتاب حطيته في الكومنتس،
ممتاز
في الشات،
ما شاء الله.
برضه بنزل على تويتر. الله يسلمك. طيب moving on to the next question. Do they accept the non-Saudis to the Saudi plastic surgery program?
Unfortunately not. يعني هو ترى ما في law يقول لك إن do not accept, because in other specialties they get accepted non-Saudis. بس plastic surgery is only for Saudis بحكم العدد قليل جدا والcompetition is extremely high, but they only take. والشيء الثاني إنه you will be sponsored by the center في الغالب, which is مثلا NGHA ولا King Faisal Specialist Hospital ولا وزارة الصحة. في الغالب السبونسر ما يجي إلا for Saudis أصلاً. it is up to my knowledge only confined to Saudi يعني citizens.
Yeah, which is actually unfortunate. So moving on to the next question, what are the number of the residents who get accepted abroad from Saudi or North America wise?
ما في عدد ثابت, ما في specific numbers, بس في agreement مثلا between Saudi Arabia as a government and France, a new agreement. They will take residents. يعني في seats designated for Saudis in France مثلا. This is as per the new agreement between France and Saudi Arabia. بس the seats I don't know how many but I think 3 or 2 I'm not sure. بس إنه في program جديد في فرنسا يكون في seats معينة designated for Saudi nationals. أما for North American board وكذا ما في specific seat ما في specific يعني number. But أنا أعرف 2 individuals السنة هذه مثلا they got accepted in Canada and different universities. فيا ممكن say ممكن 3 ممكن more but ما في specific number الصراحة that I'm aware of.
Approximately how many years of clinical attachment it would take to be accepted as a resident if not accepted immediately after graduation?
From 1 to 3 because I know residents who had clinical attachment or service for 1 year and then they got accepted, others for 2 years, others for 3 years. فما في general rule تقول لك والله you have to do 1 service year or attachment and it is guaranteed that you will get accepted. No guarantees in anything for residencies بشكل عام مو حتى بس في plastic. ففي individuals 2 3 years and ما شاء الله they got accepted eventually. في others 1 year وفي others as fresh grants. So all options are there. ما في specific number.
Personally, it took me 1 year. I worked as a service resident في الشميسي. Basically, I just I worked as a service for almost 12 months وبعدين I decided to apply for Riyadh for plastic surgery والحمد لله تيسرت يعني. I think working as a service or having opportunity to work as a clinical attachment is very amazing opportunity وبالعكس it will give you a very good basic before starting the residency itself.
Absolutely. I agree.
Another question, if I completed R1 in general surgery, can I still apply for matching in plastic surgery?
Yes, في نظام التحويل انك تحول التخصص. this year سنتي كان في one of the residents كان هو محول من الاي ار الى البلاستيك سيرجري وهي got nominated وكل شيء يعني هو دخل في النومينيشن سايكل وصل المقابلات وكل شيء اموره كانت كويسه يعني. طبعا مساله القبول النهائي من عدم القبول النهائي هذه قضيه اخرى بس المقصد انك توصل للنومينيشن وللترشيحات والمقابلات يس يو كان عن طريق نظام التحويل. وفي other residents حولوا مثلا من اوبيجايني الى اي ان تي. بعض الناس من اورثوبيديك الى ديرما اعتقد شيء زي كذا حتى من ديرما الى اورثوبيديك فيو كانت change your specialty من البورتال نفسها من الماتشنج سيستم.
Another question by Ammar Asayigh. What will happen to the other 3 nominees? Do they go to other specialties or wait another year?
Okay, that's a very good question. Actually, a common question بالفريش grads والinterns. إذا أنا قدمت على تخصص وما جاني وسويت المقابلة وصلت المقابلات سويت المقابلات وبالفاينل acceptance ما جاني ماتشنج هل أنا أنتقل للرغبة الثانية؟ لا خلاص دامك وصلت للنومينيشن الأول ورحت المقابلات you don't go back a step behind. فاللي يصير لو أنت وصلت المقابلات سويت المقابلات وما قبلت في التخصص اللي قدمت عليه you have to apply next year. You don't go to the second chance or second option, you have to apply for next year. Sometimes وصارت كثير السنة هذه بعض الناس they did not get matched they did not get accepted finally في يعني final acceptance بالتخصصات حقتهم وبعد يمكن شهر they contacted them الهيئة وقالوا والله you were put on the waiting list وفي بعض الناس they withdrew from the program الآن عندنا مقاعد شاغرة ف you have an interview عشان تنقبل you have the chance of another interview for acceptance وهذا صارت بالفاميلي ميديسن وصارت in other specialties. this is one option but generally speaking you have to apply next year and you have to take advantage خلال السنة هذه اللي بتقدم فيها السنة الجاية to take either attachment or service to have 4 points أعتقد 4 points اللي راح تقدم فيها السنة الجاية عشان to have a stronger application and you have a higher chances of getting acceptance the following year.
هي بتزيد اصلا مجموع النقاط حقتك بتزيد كثير عن الناس المتخرجين او الطلاب المتخرجين as an interns. Another question by Lan Al-Musani. She's asking, Dr. Salmai, can you give us an insight of how you're able to publish many articles of research? Because I'm a 4th-year medical student and I didn't publish anything yet.
It's okay. I started working in research in 6th year, actually. I talked about this in a different topic. I have a YouTube video about it. I can put it maybe تحت on in the يعني replies. But in general, you have 3 major ways of starting a research project. You either directly contact a colleague who is known to have published many research projects or to have good experience in research. For example, I contact Dr. Hattan. This is one way, one path. Another way is that you directly approach a consultant who is affiliated with the specialty you want to publish in. For example, I was previously interested in orthopedic surgery. I contacted a consultant in the field. I said that, Wallahi, I am interested in publishing research with you. Do you have any ongoing projects? Then it went from there. The third option is that you have an idea and you want to have a research topic about it or project about it. طبعا if you have a preformed idea, you can present it to the consultant directly, or you search in the literature for defects, and there are multiple techniques to come up with a new research idea, and then take this idea and contact the consultant regarding this idea. I talked in details about this in a YouTube video. Inshallah, I will send it to you.
نزلته في الريبلايز بورد قبل شوي.
الله يسعدك.
الله يخليك. Another question, how did you figure out if plastic was a good fit for you instead of orthopedic? What factors helped you to make that decision?
Good question. I actually prepared myself for this question بالinterviews in case they asked me about this. Orthopedic is a very good specialty. It's a promising specialty. However, for me, and this is a personal opinion, what I sensed in orthopedic is that orthopedic surgery is more of a mechanical issue. You have a mechanical issue, you have a fracture, and then you go there in the OR and fix the issue mechanically. Yani, there's an issue evident on imaging, and you go there, you fix it with a nail, with a plate, so on and so forth. ما فيها ذاك innovation, ما فيها ذاك sense of creativity that I found in plastic surgery. يعني a plastic surgeon, for example, if a plastic surgeon did a squamous cell carcinoma or a basal cell carcinoma excision on the face, each plastic surgeon can perform his own technique, his own flap, his own choice into providing an adequate and good coverage بالديفكت اللي صار بعد السكين اكسجن مثلا. ففي شيء من الابداع، في شيء من الكرياتيفيتي اللي ما لقيته موجود صراحه في اي تخصص ثاني. في مساحه لك انت كsurgeon to add to the specialty, to be creative, to come up with your own technique and then publish it, make a research about it. ودكتور قطان, Professor محمد قطان did a lot of innovative يعني techniques وgradings بالhand surgery that is of his own, Qattan's classification. فلسه الspecialty has a lot of space for innovation and for creativity for you as a surgeon to add. وهذا ما هو موجود in many other surgical specialties صراحة. So this what made me choose plastic over orthopedic.
Moving on to the next question. Are there anything specific I should start doing from fourth year, or I have to take it easy till internship?
Wallahi, as a fourth year medical student, you can start working on research. I would assume you can take summer electives as well. يعني you have I think 2 months الآن إجازة صيفية. خذ أسبوعين ولا شهر بالصيف training ببلاستيك وخذ منها recommendation letter. Make your name well known للconsultants. طبعا بدري شوي بس it's okay to do it. حتى لك أنت to explore the specialty برضه. A good chance. ممكن ما تحب التخصص بعدين. بس as a fourth year medical student, you can start attending conferences for plastic. You can start doing research. These are the good things or areas of improvements that you can work on.
All right. Moving on to the next question. What's the most recommended centers in Jeddah? I can answer that question actually.
Sure.
بخصوص جدة, there are almost 5 different hospitals, including National Guard Hospital, King Abdulaziz University Hospital, في برضو اللي هي التخصصي, وفي اللي هي مستشفى النور, مستشفى الملك عبد الله التخصص اللي هي في مكة. These are the centers for plastic surgery في الغربية أو في جدة. وفي دحين برضو one position في المدينة كمان. So moving on to the next question by Muhammad. What was the cumulative score to be matched in plastic surgery program in last year at Riyadh? And what do you think it might be in this year?
From what we know, the least accepted or nominated score in plastic surgery in Riyadh was 87.6. This was the least nominated score بالرياض, which was the highest. In Jeddah and Al-Medina and Al-Ahsa, it was less than that. But honestly speaking, I deeply believe this score will be very high or much higher this year and the year after and the year after وهكذا. I think it would reach 90, honestly, from my speculations. It would reach 90 this year, probably possibly more. ليش؟ لأن في many service residents السنة هذه، وبنفس الوقت many individuals who have scored ما شاء الله very high بالاسم لي. I'm expecting، بس أعتقد من وجهة نظري إنه the score will be high. مثلا in previous years إذا كان السكور 85 آخر نسبة للقبول وأنت جبت 86 which is one score higher, your chances of getting acceptance is very good, good chance. بس السنة هذه you need more than one score higher than the one before، لأنه نفس الشيء ينطبق على سنتي. the previous score اللي السنة اللي قبلي كان أقل نسبة قبلت 83.5. السنة اللي قبلي الباتش اللي قبلي 83.5، هذه كانت أقل درجة. سنتي أنا 87.6 which is 4 or more عن السنة اللي قبلها. it's hard to predict, but each year it's getting higher.
طيب we're running out of time, so I'll take a couple of more questions, then we'll end the webinar. Another question by Ali Al-Gharib. Can you take plastic surgery and subspecialty after earning the GS board?
Yes, you can, but not in Saudi, in North America. صح؟ Correct
yes.
me.
Yeah, that's true. لازم تسوي plastic surgery board عشان to become a plastic surgeon هنا في السعودية. حتى أعتقد في أوروبا، بس هو في أمريكا you can do residency after general surgery. بس you have to repeat the residency بس in plastic surgery after GS. في أمريكا. طيب another question. Do I need to prepare or do anything to increase my chance of getting accepted as someone who's still in the second year?
No, that's too early صراحة but again research ممكن to begin with. Electives إذا ما أنت متأكد من التخصص. لكن the second year I think from my opinion as a second year medical student ركز أكثر على GPA حقك. Maintain your GPA because you have priorities. والآن البلوكات صعبة. basics البلوكات البيسك أصعب من الكلينيكال. just maintain خير وبركة لو your GPA is high at this time. لاحقين بعدين لسه you have a lot of time to work on your CV إن شاء الله.
Yes, I totally agree with you. GPA is the most important thing في basic years. بعدين في another question. What are the differences between attachment and service?
Attachment هم طبعا كلهم the same points when it comes to the CV points, but attachment is unpaid service, so you are training without payment for the sake of training and gaining experience, whereas a service physician is actually an employee. You have a contract, you are getting paid, you have duties, you have working hours, specific working hours, and so on. Whereas the service, it's unpaid. عفوا attachment.
Attachment unpaid. Service basically is paid. Attachment is not paid or unpaid. Question by Rahaf. How do I find an opportunity to participate in plastic surgery research?
Our club.
Yes, exactly.
It's short.
Another question by Muhammad. After nomination, what parameters that conclude the choice of acceptance besides research and electives?
Good. Let's say elective. During electives, all of us did electives, but أكيد your experience is different than other person's experience. You have to leave good attitude, good feedback, good impression على نفسك during elective. So electives مهمة جدا. Recommendation and reference letters. If you have recommendations and reference letters from big names, your chances of getting accepted إن شاء الله is higher. لأنهم كلهم يعرفون بعض ويعرفون والله لو أنت ماخذ recommendation من شخص معين in this you are truly a good person حتى لو ما تدربت عندهم في السنتر. كذلك your connections. you have to present. بعض الناس ترى they do a whole internship training شهر كامل without introducing themselves to the consultant. consultant does not know your name. You have to be there بالclinic to introduce your name, to show up on time, هذا الأشياء التفاصيل دقيقة they do make a difference. فوش بعد recommendation research electives وطبعا your interview طبعا جدا مهمة. وقت الانترفيو your attitude and your answers to their questions بالانترفيو they do make a difference.
Yes, I totally agree. I think interview is the most important factor for getting accepted في plastic. How you do in the interview. في paper was published by Dr. قطيبة entitled the ideal applicant for to the Saudi plastic surgery residency program. They actually found that the most important factor is actually who had good impression interview, but then a prior experience in plastic, but then research experience, but then GPA, but then if they had any oral or poster presentations, but then SMLE, and lastly if they had any postgraduate degrees. I will link the article for anybody who's interested.
مهمة جدا هذه الارتكل evidence based. عشان
فهذه سووها على البروجرام دايركتورز في السعودية وايش الفاكتورز اللي actually يعني made them choose the ideal applicant for the Saudi board. طيب we'll go through the
as we can see ترى ال SMLE وال GPA على مؤخرة اللائحة. they don't care about your GPA and SMLE. والسنس انك وصلت للانترفيو، دامك وصلت للانترفيو خلاص انت كواليفايد انك انت تقبل ان شاء الله. باقي بس ادائك وشخصيتك والسي في حقك عدا فضلا عن طبعا بعيدا عن الجي بي اي والاسم.
تمام. We'll go to the last question. Does the lifestyle in plastic surgery same as general surgery and residency?
No, I'm not sure which one is more depending على السنتر. بس مثلا الجي اس بالحرس is extremely demanding, it's hectic. فبشكل عام البلاستيك surgery is a tough program. It's not easy. It's not like other. It's not like ENT يمكن much more demanding, long working hours, long ORs sometimes. It is not easy honestly, but it's worth it إن شاء الله.
وبالذات البلاستيك ريزيدنس عددنا قليل، فمن ناحية يعني الورك لود بيكون مرة عالي وعدد القليل، ففي مرة شورتج من ناحية الكفرج for inpatient, outpatient وحتى clinics يعني من ناحية بالضبط. ف you have to take extra on calls to cover this shortage.
Yes.
يعطيك ألف عافية سلمان، ومن جد يعني كان وقت مرة ممتع معاك، ومن جد أنا شخصيا استفدت والله.
يسعدك والله. أنا كنت أحضر البينارز من I'm presenting one، فالحمد لله يعني.
الله يسلمك يا الله، ما شاء الله عليك والله، وإن شاء الله بإذن الله عالم مناصب، ومن جد يعطيك ألف عافية. وبالنسبة للحضور إن شاء الله الويبينار بيكون مسجل وبنرفعه إن شاء الله على اليوتيوب، وبرضه الروابط اللي ذكرناها من ناحية الكتاب نصح فيه دكتور سلمان أو حتى الارتكل اللي حطيتها والفيديو حق دكتور سلمان برضه إن شاء الله بنحطه على حسابنا في تويتر اللي هو بلاستيك سيرجري انترست كلوب. وبرضه إذا ما أنتم متابعين دكتور سلمان تابعوه على تويتر، ويعطيكم ألف عافية وشكرا لك. Any last words دكتور سلمان؟
شكرا جميعا على الحضور، وإن شاء الله دعواتنا الصادقة لكم كلكم بالتوفيق إن شاء الله بالأماكن اللي تستحقونها وتتمنونها يا رب. وحنا موجودين أنا ودكتور هتان إذا عندكم أي أسئلة أو أي شيء حنا في خدمتكم، وإن شاء الله يعني بإذن الله كل واحد يقبل بالتخصص اللي يبغاه وبالسنتر اللي يبغاه بإذن الله.